Well, I want to welcome everybody. Thank you for attending today. And for those of you who took the time to complete the pre-webinar forms, thank you for that as well. Looks like we're going to have a variety of folks here today, from medical students to community faculty to graduate medical education faculty. And I hope that the webinar will meet all of your needs. So we are honored and esteemed to learn that this is, or the session that we presented in Jacksonville last spring was named Best of. I'm Cecil Robinson. I'm Director of Learning and Evaluation and an Associate Professor of Medical Education at the University of Alabama. And I'm happy to be presenting with Dr. Dobbie, a physician and Chair of Family Medicine at Eastern Virginia Medical School, and Dr. Tysinger, an educator like myself, who is the Distinguished Teaching Professor and Vice Chair for Professional Development at UT Health San Antonio. So this webinar was developed collaboratively among all three panelists, drawing on the literature and our collective experience of working with students and faculty members. And although it was developed collaboratively, for the sake of flow and continuity, I will be presenting the first part of the webinar. However, we've also tried to build in a fair amount of time for discussion and questions. And at this point, Drs. Tysinger and Dobbie will join in the discussion and answer questions to elaborate on the points in the webinar and to share their wisdom and distinguished experience in medical education. On for some of the administrative stuff. Unfortunately, we have nothing to disclose. As for the learning strategies, or the objectives for this talk, learning strategies, implications for student and faculty development. One, we want you to think about what learning strategies are, and more importantly, give you some concrete examples to help promote the performance of medical students and residents alike. So for those of you who completed the pre-webinar survey, you've seen this scenario before, but for those who haven't, imagine that a struggling student comes to you at the beginning, trying to be proactive of your family medicine clerkship, and pleads with you, please help me better prepare for your exam. I asked y'all what you would say, and it turns out about 25% of the respondents said that you weren't sure what we would say in this scenario. Maybe that's one reason why you wanted to attend the webinar. But about 40% of you highlighted that you would assess or help develop students' learning strategies. And this is great. However, only 2 provided specific ways in which they would help develop learner strategies. The purpose of this seminar is to help better equip you when a medical student or a resident is struggling, or even if they're not struggling and just want to do better, so that you could help give them a specific way forward. Now, before we go on, I wanted to give a couple of notes. One around learning difficulties, since 20% of folks highlighted the possibility of referring the learner for an evaluation. Dr. Tysinger and I talked about it, and the learner scored 198 on step 1 and passed the other clerkships. Therefore, we kind of feel the likelihood of having a learning disability is low. More pragmatically speaking, the student's already in clerkship. It's not likely that you're going to get the results of an eval back within the next month. Therefore, it's not really going to help them during your clerkship. Plus, it's going to be expensive. So rather than focusing on a potential learning difficulty, I think another alternative is that they have not yet developed their cognitive toolkit, learning strategies that all of us use to adapt when we encounter difficulty in a learning situation. I also want to provide a note on learning styles, since about 10% of y'all identified that as a potential way forward, and we'll see learning styles come up again with the second scenario. There's little data to support the differentiated use of learning styles to help learners. It's good teaching practice to utilize multiple representations and multiple modalities in your teaching, but research shows that it does not differentially affect the learning outcomes for students. It benefits all students. And I think it's also important to consider that all students are going to be taking the same high stakes test. The makers of the exams do not offer learning style accommodations. So I think it's our responsibility to prepare students to take the exam as it is. Now, look, I don't mean to be controversial in making these statements, and I am happy to talk with folks afterwards. Just shoot me an email. But as a psychologist and an educator, I want to accurately report what the research is telling us. And with that, let's actually turn to what the research does tell us as it relates to learning strategies. So first, a bit of background. The concepts that we're talking about here today are taken from the science of learning. You can find this literature from the Institute of Educational Science, the National Research Council, APA, and all of these practices that we're going to talk about come from several decades of research, all have moderate to high effect sizes ranging from 0.4 to 1. And perhaps more importantly, these are the strategies that I've used, that Dr. Tysinger and Dr. Dobbie has used to help a range of students over the years. As an example, I've worked with struggling family medicine residents who have doubled their ITE score by using these strategies. They have also, I've worked with pre-med rural students who were struggling on their MCATs. Perhaps my greatest success story, I had a person scoring in the 8th percentile after taking the MCAT 3 times. But after applying some of these strategies, this past spring, scored 80 in the 85th percentile on the MCAT and just found out he was accepted in early admission to his med school of choice this fall. Pretty cool stuff, right? And it works because it's based on the science of learning, not based on how we were taught or how we studied. Because it turns out there might be a disconnect between the two. All right, so I want you to think for a minute. And I don't need you to type it into the screen or anything, just reflect on it. But what is the best predictor of human performance? Turns out the answer is deliberate time on task. Some of you might have heard of the magic number of 10,000 hours to expertise. This is derived from research stemming back to the 1940s, but it is the best predictor of performance. So for any of you in the webinar, or for anyone who knows colleagues who have ever written read more as the feedback to a learner, you're not wrong. We do need to read more, right? Or we do need to work more. We do need to spend more time on task. But notice the modifier. It needs to be deliberate, because not all studying is created equal. And given medical student and family medicine residents limited time, we want them to work smart, efficiently, and effectively to produce the highest yields in what they're doing. So when we think about learning strategies, they are not skills. It's how we approach a task. It's the executive process of choosing, coordinating, and applying skills, of monitoring our comprehension, and of adapting our thinking and action to accomplish a task. So speaking of learning strategies, I now do want you to participate. I want you to take 30 seconds, and I want you to read the list of learning strategies to the right. And as you read through, I want you to type the strategy or strategies that you think have the lowest effectiveness into the chat box. And Emily, what are we getting?
All right, so I think we're gonna give it just a second here while everyone finds that chat box, and they're starting to pop in. Rereading is one of our first audience suggestions. Yep, rereading is definitely a popular one. Somebody else just suggested that as a least effective. Anyone else got any suggestions? Oh, that's okay. Mnemonics, somebody else. Spaced practice, somebody suggested. Highlighting. And interleaved practice are all
right.
suggestions that have come in.
So all over the board, but it seems like the mode happens to be rereading.
Mm-hmm.
Fair enough. All right, now I'd like y'all to type in what strategy or strategies you think has the highest effectiveness into the chat box.
Summarization, somebody suggested. Somebody else suggested interleaved practice and spaced practice, and then imagery use, elaboration and explanation, spaced practice, lots of those are coming in, and elaboration and explanation and interleaved are all pretty popular. Lots of spaced practice.
All right, great. One more. And this is so that I could get a sense of the audience. Which phrases have you never heard of or don't understand and you'd like more clarification?
Someone says, haha, nice. Interleaved practice and spaced practice.
Good.
And a few people say interleaved practice, and then someone wants to know what the keyword mnemonic is. But interleaved practice is by far the most popular. There's like 4 or 5 people who are asking what that means.
All right, great. Yeah, one of the difficulties of a webinar is that I can't see y'all, so I'm trying to make this as interactive as possible, and I do appreciate y'all taking the time to type in your thoughts into the text box. So it turns out that folks have done a meta-analysis on the effectiveness of these different learning strategies. And it turns out those who said highlighting was not effective wins the prize. What I think is interesting about highlighting, it's not just that it might not be effective, but that they were unable to find a single study demonstrating highlighting improving performance on application-related questions. A keyword mnemonic for the person who asked, think about Roy G. Biv, right? In trying to, as a mnemonic to remember the spectrum, right? Or every good boy, girl does fine, or whatever the mnemonic was for that. Obviously, it wasn't very powerful for me. I fall into the variable category. But regardless, what I think is interesting are some of the things that we often talk about, or perhaps more importantly, that we used as learners and our current students use to learn material. Rereading, summarizing, highlighting are at best variable in their effectiveness. It turns out the bottom 4 have moderate to high effectiveness for application questions, and if we're just talking memorization as well. So with that being said, these are the 4 that we're going to focus on today. Which I'm glad to hear that some of you needed more explanation on these areas, because if you didn't, the whole webinar might have just crashed and burned, because that's what we're going to talk about anyway. All right, so with that being said, let's explore elaboration and self-explanation. I chose these 2 images because I think it represents one of 2 courses that students can take when trying to develop their understanding of new material. The first is developing themselves, or developing the information, memorizing that information like an island. So you can imagine a whole bunch of islands in the South Pacific that represent someone's knowledge base. The problem is that it's really difficult to get from one island to the next. In contrast, we could think about a net or a network, right, of all these connected dots. And ideally, that's what we want to strive for to promote deep understanding of a topic. You know, many of you in the room today are physicians, so I don't need to talk to you about how cortical activity works. You know, but this idea of spreading activation is really important, because for those of you who don't know about this, the idea is when we are asked to answer a problem, from a psychology standpoint, we talk about this as retrieval or recall, right, from long-term memory. And it turns out that when we try to recall a piece of information, certain areas in our brain will fire. But then through spreading activation, associated neurons will fire in the same general area. Well, when you're an island, the amount of firing is very small, but when you're a connected network, it's great. And so when we only memorize facts, either you're able to remember it and recall it, or you're not. The likelihood of spreading activation, activating that memory so that you could draw it out of your memory is really unlikely to occur. But when you have a well-connected network of information, that spreading occurs. And even if you don't remember it right away, we all probably have that experience where, hold on, let me think about it. And then it eventually comes to you. That's the idea of connected understanding. So in order to do this, we need our students and our learners to ask questions while studying about how and why things work. It's not just about the piece of information, it's about how they're related. Ways to promote this in your teaching and in their studying is to use a lot of compare and contrast. By the way, using compare and contrast in teaching yields some of the highest effect sizes from classroom instruction. An effect size of 1 is about what you get when we use compare and contrast different cases, different topics, different ideas. And just in general, as we need to have our learners just try to make connections between different ideas. All right, moving on to practice testing. I want you to reflect on a few questions that I'm about to ask. Again, you don't need to type it into the screen. I just want you to reflect and to think about this. And these aren't trick questions. Here we go. How do you know when you make a shot in basketball? And again, not a trick question. How do you know when you hit the right note while singing? Why do you monitor vital signs of a patient? And finally, how do you know that you've learned something or that a student has mastered a concept? In basketball and in singing, you know because the results are directly visible, right? We monitor vital signs because blood pressure and heart rate is not readily visible, so we make it visible to direct our plan of action. But learning is a special case because we don't know what's going on inside someone's head. So it raises the question, how do we make learning in the classroom or clinic visible? Before I answer that question, I want to talk about the importance of feedback. When we practice, whether it's Q banks or reading about various cases, it's not just so that we could get the experience, it's so that we can make visible our performance, right? Because when I take a test, I know the percentage I got right and wrong, right? It's making visible what I'm able to do in the same way that when I take a shot in basketball, I could see if I fall short, if I go left or if I go right, or if I sing a note, right? And I hear that I'm flat or sharp. Well, in both instances, I adjust accordingly, right? If blood pressure is precipitously low, I trust that the physicians in the room are going to adjust accordingly. But as I said before, learning is not as obvious as the other examples. When you highlight, what feedback do you get as a learner that you know the material? The result is merely a reminder to review it later. You get zero feedback from highlighting. And when you read, what feedback do you get as a learner that you could apply what you've read or watched in a clinical setting? And the answer is none from reading alone. Therefore, as instructors and learners, we need to find ways to study that produce meaningful feedback that could let us know whether we made the shot or hit the note, as it were, in the classroom, and provide data to tell us what to do next. So when we think about what feedback learners have in class and in clinic to make the invisible visible, the answer turns out to be a lot. When we think about class, anytime our students are participating in activities, they're providing feedback for us and themselves. Same thing with quizzes, midterms, assignments, even the use of clickers, right? But I think the one of the issues is that students don't realize this. I don't think instructors realize this either, right? That we can use the data that we're getting to make decisions about where we need to go next. Right? I want you to think about this for a minute. Were y'all taught how to study? I wasn't. I generally figured it out on my own. And in my 25 years of education, I used to teach pre-service teachers going into K-12, and I would ask them this question. I could tell you that over 95% of future teachers told me that they were never taught how to study. And so what's interesting about it is that the research tells us that these are strategies that can be directly and effectively taught, but we need to create a culture of learning so that the students and the instructors recognize these points of data that they can use in their own teaching. Now, I know it's not the focus of the talk, but we also generate this feedback in clinic. Right? It's why we have students do case presentations so that you could figure out how they're reasoning and hopefully give them feedback to adjust accordingly. It's why we observe them doing H&Ps with entrustable professional activities so that we could give them feedback to improve what they're doing. And it might also be said that that's actually one of the benefits of a longitudinal integrated clerkship. When a medical student develops a management plan for a patient, and then they're able to see that patient 2 or 3 more times because of the continuity experience that they have through their longitudinal clerkship, well, then they're receiving direct feedback on the effects of their plan in ways that they otherwise couldn't in a traditional clerkship where it's a one-off. So something to think about in clinic as well. All right, so what about when students are on their own when they're studying? The big idea here is that I think we need to convince students to turn all studying into a form of practice or quiz. Right? So you can see some of the things I have listed there. Free recall of material. Rather than just reading and then moving on, read the material, close your book, and then try to recall what you just read. If you are unable to recall what was just read, open it up and reread it again. Close the book and then try to recall what you just read. The same thing is true with closed book notes and flashcards. When you're reading, rather than scribbling a flashcard by copying what you have in the book next to you, instead, close your book and then try to take a note with your book closed. If you're unable to, you don't know the material well enough, so open up the book again, reread it, and then close it, try to take the note. Once you're able to take the note without using the book, the learner has just provided feedback to themselves that they made the shot, that they hit the note. But don't move on until you know that or you do that. So these are simple ways in which we are turning rereading or note-taking into more effective strategies because we're engaging in practice testing. Right? The same thing could be said for study group quizzes, or perhaps splitting up the different sections. Learner A does topic A, learner B, topic B, learner C, topic C, and each of the learners then have to teach one another the various topics. All right, and of course, what everybody knows is to do Q banks, and that's important, but we can't stop there. Practice is only the first step. We need to think about doing practice problems as analogous to lab results. We don't do them to do them. We do them to identify our strengths that we need to review and to identify concepts that we still have to learn. In other words, we do practice problems not to do practice problems, but rather we do practice problems to direct what we're going to study next. So this has some implications for what you might tell your students. Rather than reading the chapter first and then taking the questions, I actually think that we should flip it. Not just me, but the research says that as well. Have the students take a quiz first. And it turns out they're not blank slates. Even if they only get 40% of the questions right, well, now they've identified 60% of the material that they need to read. And if they're going to spend the same amount of studying, but they're only covering 60% of the material, well, now they're spending 40% more time, dedicated, deliberate time on the areas that they need, rather rereading the stuff that they don't. So we quiz ourselves first, we generate the feedback to assess our understanding, and then we use the results to guide what we're going to read and study. Once you read and study, test yourself again. Continue this process until you've mastered the material or you've achieved the goal that you're setting out to do. And by the way, there's an additional benefit with regards to anxiety. And the idea is that if I know going into a test that I've been averaging, let's say the ITE exam, right, that I've been averaging 75% on my questions over the last 1,500 questions, well, then I'm going to be less nervous when I'm taking the test, because I know that for the past 6 weeks, I've been scoring at a level that is significantly higher than I need to benchmark on my ITEs and to ace eventually the board exam when I take it the following April. So with that said, I want to turn to a scenario. Some of you have seen this scenario before, but essentially it's a student who's being proactive, who's doing practice problems, and lets you know during a break in clinic that they answered 60% of their questions correctly on a recent practice test. But they want to know if you have any tips on what they could do to continue to improve. So thanks again to those of you who completed the pre-webinar survey. And like the first scenario, about a quarter of you said that you really weren't sure what you would tell them. But 50% of you identified that, well, we would target the areas of struggle. And that's great. It's largely consistent with what I've been talking about up to now. But I want to add to that as we become more concrete with rubber meeting the road. Remember, the questions are like lab results. And so I agree that we need to use the data from their performance to target areas of struggle, but I also think that we need more information. And I'm going to suggest 2 specific areas of struggle that we often don't spend enough time on. And I'm also going to suggest something that might be controversial. But before I do that, I want to create a caveat to any of the above. And that's that whenever we're doing these questions, we need to make sure they are high yield questions using the content outline that's provided for us from the testing source. So we need to establish whether or not it's worth focusing on the problem. So for example, while I personally think that male reproductive health is important, and that I definitely want my personal family physician to know their stuff when it comes to that topic, I also know that there are only 2 out of 240 questions on this topic on the ITE and ABFM board exam. So even though they might miss a male reproductive health question, I would rather them study high yield areas like cardiovascular, respiratory, musculoskeletal, endocrine, or GI, which have 125 questions and represent 52% of the test. Right? So with that caveat, remember, use the content outline to establish high yield areas. Now let me turn to some of the different areas. We have mastery understanding. And what I mean by having them break out by mastery understanding is that I got the question right, but not only did I get the question right, I could tell you why those 3 distractors are incorrect. I could take this problem 10 different times in 10 different ways, and I am confident that I'm always going to get it right because I know my stuff. But if you notice, I now have a second category, and those are the questions of narrowed, guessed correctly. Right? And I would like to, well, from my own experience of working with learners, this is an area where most learners skip. They don't study this area, right? Because they got it right. So they count their 60% as, well, I got 60% right, so I'm going to focus on this 40%. But it turns out that embedded in the 60% of material, that there are some questions that I actually guessed on. I mean, there were educated guesses, right? I narrowed it down to 2, but there were guesses nonetheless. And so just because they got it right today doesn't mean they might get it wrong tomorrow. And if they don't study that area, then they're at 50% risk that they're going to get the question wrong the next time they take the exam. So rather than worrying about whether or not the learner answered the question right or wrong, I want them to focus on whether or not they understand the material. And it turns out that if we focus on whether they understand the material, I really don't consider these categories to be different. They're identical. The only difference is that the learner happened to guess right on some and incorrectly on others. Right? So regardless of whether one guesses right or wrong, these 2 categories need to be reviewed by the learner. Both demonstrate a gap in their fund of knowledge, or what Andrews et al. Calls a lack of script specificity. That is, the learners can narrow it down, but they can't close the deal. They don't know enough or do not have well enough developed scripts to eliminate the final distractor when answering the question. So, by the way, these 2 categories are the questions that I recommend learners focus on first. And I do so because these are high yield questions. Usually with only a little bit of work, learners can fill the gap in their fund of knowledge and move the questions from the narrowed pile into the mastered pile. And essentially that's our goal, right? Is to just move as many questions as possible into the mastered pile. All right. As we think about this one, right? I didn't have a clue. I just kind of threw a dart. It hit C. I put C. Now, this might sound controversial, but I recommend that learners skip questions that they don't know. Don't study them. Because if they are completely guessing, then there's a large gap in their fund of knowledge, and taking the time to fill in this gap is certainly important, but it is low yield as it relates to improving overall performance on a high stakes exam. Instead, I recommend that learners continue to work problem Q banks and focus on the questions in which they narrowed. And as I mentioned before, this is the high yield work, as there's less of a knowledge gap that needs to be filled. Now look, these items are not mutually independent or exclusive of one another. So as learners work problems and use these problems to derive their deliberate and focused study, then what they're going to find is that problems in which they previously guessed will start to move into the narrowed category, because as you answer the narrowed questions, you're still expanding your fund of knowledge. And so again, what we're trying to focus on are high yield results. All right. Have you ever had the experience where you thought you knew something but didn't? Right? Or have you had the experience that after getting the question you thought you had right, wrong, you go back and study it, and then on the final exam, you make the same dang mistake again? I know that I have. And chances are you have too. And it's because it's a special class of response. And this is where the learner has a mental model that is telling them to go right instead of going left. And when this happens, a learner has a faulty mental model, and they need to really examine why they think this way, and then do everything in their power to try to break their incorrect mental model. They need to try to figure out every way that their mental model will do possible harm to the patient, and work to develop why they need to turn left instead of turning right. And I highlight this because unfortunately, the science of learning doesn't have good solutions when it comes to breaking faulty mental models. And from an evolutionary standpoint, this makes sense. Mental models are purposely hard to break as they govern how we interact in the world. We would be easily manipulated or confused if we could just alter our mental models willy-nilly. So with that said, I think it's just really important to recognize that if a learner has a faulty mental model, and then just taking time to examine why that's the case, that's going to go a long way in working to create a more appropriate model. So revisiting the scenario that we need more data, we need more data because all learners are different. Consider the following 4 learners. All of them scored 60%, but look at how each of them did so differently, right? Learner A guessed on 20%, and they're likely not going to study it. Look, they're probably going to be fine, but check out learner B, who's only mastered 10% of the material and today happened to be really lucky at the casino, right? And they correctly guessed on, 80% of the questions that they had to narrow down. Chances are it's not going to happen in the future. And more importantly, if they don't study those that they guessed on, they're at high risk for failure in the future. Right? And then we have a learner C who scores 60 but still doesn't know. It's balanced between correctly and incorrectly, but they have a lot of work to do to really move mastery. And finally, we have learner D. Right? And by the way, this has only happened to me one time and with all the learners that I've worked with. And it resulted from a learner who had several failures on their STEP exams and became underconfident in their ability, which meant they started overthinking their answers. And you can tell that this is occurring because you consistently see more incorrectly narrowed questions than correctly narrowed questions. The solution is to have them stop overthinking. What their first answer is, they need to write down, and very quickly you're going to see this person move from 1040 to 2525. And so what's interesting is that learner D of all of them, once we correct their overthinking, they will jump from a 60% to 75% once the narrow correctly goes to 25%. So the point is, all learners are different. When we practice test, we don't do it just to do problems. It's because we need to make the invisible visible, to provide feedback, to monitor our progress, and adjust action as appropriate. All right. With that said, I'm going to jump to space practice. Has anyone ever crammed for an exam, forgotten everything that you studied by lunchtime? I know I have. And the problem with that is that it's creating more work for ourselves, right? I'm going to have to relearn for the final or STEP or shelf exam or board exam, right? More importantly, doctors don't forget. Let's try to remember for retention, not just to pass the immediate test. And the way that we need to do that is through spaced practice. And what's cool about spaced practice is that note that we are not increasing the amount of time that learners are studying, right? We're just changing, organizing how they study. So for example, rather than cram for 7 hours, we're going to study for 40 to 60 minutes each day the week before the exam. And what we find out when we do recall tests 3 weeks later is that people who use spaced practice retain far greater information than students who don't. So how do we space practice? Just need to plan early, setting aside a little time every day. That's it. And when we're reviewing, just be sure to use effective strategies like practice testing and elaboration, as we've talked about. But it sounds as though some of you are familiar with this, so you might have already encountered this. But for those who haven't, I want to offer a warning. It's going to feel funky. Students aren't going to like it because they're going to feel that they haven't learned the material yet after only studying for 45 minutes to an hour. But guess what? It's a good thing. It strips away this illusion that we know something because we've become familiar with it after staring at the material for 4 hours, but then wonder why we score so poorly on the exam. So learners, when they initially start it, are going to report that it's not effective. But here's where I need you to trust the process and trust science. And the students will come to as well after they get their first couple of exam scores back. All right. Beyond space practice, interleave practice is kind of similar. I'm guessing that most of you learned to write your ABCs using the figure on the left. I know I did. Very few of us were practicing our writing using it on the right. The problem is that we don't actually write any words other than perhaps www or xxx that just have a repetition of the same letters. We write like what we see on the right-hand side. It turns out that writing in this interleaved fashion, in which we are interleaving different letters as we try to produce different motor skills, is more effective than blocking everything using the same motor skill of just writing A. So to teach writing, practice writing words, not repeating the same string of letters. The same thing is true of studying. Right? Switch between ideas during a study session. So imagine we've got a super conscientious student who's studying 6 hours a night. Rather than breaking it up where we're doing biochem, genetics, histology, and physiology on different nights, do each of them daily, and then interleave the order in which you study them. So same warning applies for interleaving. Learners aren't going to feel comfortable studying this way. But again, I'm going to reiterate what I had said before. Their lack of comfort and even the idea that they might forget something because they only looked at it for 45 minutes is a good thing. In one instance, we're removing the illusion of knowing. And in the other, we're forcing continued recall, which is going to improve their performance later. So to review where we're at, I've covered 4 things so far. Practice testing, in which we are going to quiz to monitor progress and direct where we need to move next. Space practice, we're not going to study everything all at once. We're going to break it up over time. Not only are we going to break it up over time, we're going to switch ideas during the study practice as we interleave. And while we're studying, we aren't going to create islands, we're going to create networks. All right. Finally, all of this is fine and good, but if we don't develop a plan, we're sunk. People who struggle don't have a plan or not realistic plans. It doesn't mean you can't struggle with a plan, but the likelihood's diminished. And without plans, it's what learners develop what Andrews et al. Calls inappropriate adaptive inferences. They know that they need to study something, but they don't know how. They don't know how to move forward. So one thing that we can do is help learners develop a learning plan. They need to be realistic. They need to focus on their wellness. We need to use our SMART goals that are specific, measurable, achievable, realistic, and time-bound. And let me add, from a wellness standpoint, we need to savor our success. We need to find ways to continue to fill our buckets so that we're energized to keep moving. So take this one learning plan that a student might have for today. Not bad. I'm going to go to clinic in the morning. I'm going to study over lunch. I'm going to do clinic in the afternoon, eat some dinner, get in a workout. I'm going to study and do some practice questions. Not terrible, but definitely not specific. And certainly not developing the idea that we could turn clinic time into study time. Take this more detailed plan. It's still the same as what I showed you on the previous example, but it's broken out, right? Let's read about the 1 to 2 patient conditions that we've identified in the 2 to 3 patients that I'm going to see as a medical student in the morning. Right? After I present to my preceptor or attending, I'm going to continue to read more about each patient. Right? And while I'm reading, I'm going to practice deliberate, effective strategies to elaborate. How? By using a free recall of signs and symptoms in relations to the pathophysiology, or a free recall of recommendations for treatment, management, and prevention. I'm not just going to read, I'm going to actively test myself on what it is I'm reading about, so that not only am I ready to go when I see the patient, but I'm also learning the material just as a matter of course by being in clinic. I'm going to repeat this in the afternoon, and then when I go home, I'm going to do some UWorld questions. But if you notice throughout all this, I'm still FaceTiming with my family. I'm still having dinner with friends. I'm still enjoying my cup of coffee. And you notice how I'm savoring, or I have the savor in parentheses. It's not just that I'm having dinner with friends, but I'm taking a minute to be mindful of the fact that I've earned this relaxation time with my friends because I had a kick butt day in clinic, right? I'm savoring the FaceTime with my family because I earned it, because I totally just hit my goal of 75% on the UWorld questions I'm doing in preparation for my shelf exam. The same thing when I'm vegging out in front of the TV, it's like, oh, it's not, oh man, woe is me. It's, man, I'm totally prepared for clinic tomorrow with all the articles that my preceptors and other folks wanted me to do. And I'm going to sleep well knowing that I had a good day, and I'm going to have another good day tomorrow. And although you notice that this is still a long 10 to 12 hour day for a medical student, we're still getting our 8 hours of sleep. We're still getting 5 hours of food, workout, free, and savor time. We're able to accomplish our goals and maintain our wellness. And of course, on Fridays, they could take Friday night off. Why? It's a bigger savor because we've put in a good week. But they're going to develop specific plans for Saturday and Sunday to still get in several hours worth of work on the weekends. Now, the one thing that I want to tell you about this is that we need to be specific when creating a schedule. We need to get up in their business sometimes about when they get up, how long they need to get ready, so that we could help them manage their day. And it's amazing what students are able to fit in when we do that. So just one more time before we move to our Q&A session. But again, we're going to practice test, not because we just love doing questions, but because it's making the invisible visible, and it's driving our decisions, our lab results about what we need to do next. When we do something next, we're going to space it over time. We're not going to be an island, and we're going to interleave different topics. And we're going to do so following a plan that we've developed. Pretty straightforward things that have pretty big implications. So now I want to open it up to you and for Dr. Dobbie and Dr. Tysinger to join in. And let's revisit the scenario. Having listened over the last 45 minutes or so, now what would you tell the student? If you could take a minute to type it into the text box, that would be fantastic. And while you're typing that in, Dr. Tysinger or Dr. Dobbie, do you have anything you want to add that I missed?
Not for me.
All right, Emily, are we getting anything?
Not yet. I think people are still thinking about what they might share. We have a few questions that came in, but people are still writing, I think. Okay, so we have somebody who shared, let's review the results that they would say, well, let's review the results of your exam and the areas that you had trouble with.
All right, good.
And then someone else says, we need more detail on your study habits.
Nice.
Excellent. I'm glad I didn't put everyone to asleep. So luckily we're still getting folks typing. And while you're thinking about that, having run professional development and having had to participate in many professional development workshops, I want you to think about one thing that you learned today that you're going to share with a learner this week.
And so while they're thinking about that, I'll just say that another person had they would suggest spaced practice and interleaved practice. And somebody else, Lisa, had said that they might ask, are you cramming or interleaving your study?
Awesome. Yeah, I think cramming is a way that it's purely organizational, right? The student's already putting in the time. All you're asking them to do is break up their time differently.
Mm-hmm. All right, so does anyone want to go ahead and write in the learning strategy that they were going to apply that they'll share with a learner this week? And we have somebody who says that they will suggest to a resident to practice interleaving with clinical experience.
All right, excellent. Now, Emily, you said that there were several questions.
Yeah, so we had one question that had come in kind of while you were still in process with the session. So I don't know if it got answered kind of in the middle. One of our listeners, Donald, had asked, you have focused quite a bit on how to improve test answering, but how do you effectively teach students to improve their fund of knowledge, not just how to answer questions correctly?
All right, so I think there's a couple components to this question. First we have to ask ourselves, is it a good test? So for example, imagine that you're trying to teach a student how to write. And the end result is a really good narrative. Well, you taught them how to take the test because the test was a narrative. So I think the larger question is, are the questions that they get on the board exam representative of some of the fund of knowledge that you want them to know as physicians? And if so, when you teach to the test, you are developing their fund of knowledge. Now, if not, well, then it's not a matter of not teaching to the test, but rather we need advocacy work to improve the test. Right? In the same way that when I coached baseball, when I was in graduate school, I was teaching my players to the test, right? Because the test was when you step onto the field to score more runs than your opponent. That's not a bad thing. It's what a good coach does. Now, if we didn't like the test, we would have to change the rules of the game. And I hope that started to answer your question a little bit. I know it's indirect, but I don't see the distinction between fund of knowledge and teaching to the test. When you have a good test, they're identical.
Well, Cecil, I think it's important to emphasize to the learner, whether it's a resident or a medical student, that we're not giving them simple tips that will help them score better on the exam. We're giving them information to increase their fund of knowledge. Hopefully their preceptor will ask application types of questions as opposed to rote memory questions, because that's really what drives learning. The other thing is we want to build students' confidence. I think we all have encountered students who have just been beaten by the medical education system. So doing these counseling and strategies education can help students gain that confidence back. You mentioned the student who went from the 8th percentile on the MCAT to the 88th percentile. Did that student's confidence also increase?
Oh man, I think he grew about 4 inches and his chest became 5 inches wider.
Yes. So knowledge or feedback, as you presented, about performing better on the exam is essential. But when someone's precepting a student, especially someone who's struggling, adequately encouraging them, telling them, great job, I really like the way you did this, or the way you answered that question, you gave me detailed evidence, that really drives learning too.
Agreed.
This is Alison Dobbie on the telephone. I wanted to add to these wonderful things that the gentlemen have said by saying elaboration is a very, very useful way to teach in the clinic. When you see a person with abdominal pain and you're getting a diagnosis, saying, well, this is a woman of 26. How would your diagnosis change when it's a man of 55 or a female of 87? And how would your workup change? And how would, and so on. So I think that's a very practical way of really helping people expand their knowledge in the clinical setting.
I think that ties in a little bit to a couple of comments that came in. Like we have one comment from Benjamin who says, too many tests are bad though and don't reflect practice or are seen through personal context or filters, e.g. the SAT. And I think that to me, that makes sense though, that some of what you're talking about tests is even like testing yourself or making practice tests. It's not only just talking about, you're not only just talking about certain exams, but that the idea of testing yourself or elaborating is the process of learning. Does that kind of make sense?
That's a great insight, Emily. And to speak to the SAT, I agree. Ability tests are very different than tests of competency. But going back to Emily's point, I think that that's right on the mark, in that essentially the idea of taking tests to improve our fund of knowledge aren't necessarily just a board exam or a shelf exam, but it's every day finding ways to make the invisible visible, whether you do it through free recall, whether you do it through note-taking, whether you do it through elaboration, as Dr. Dobbie alluded to in the clinic. All of these things are making thinking visible so that we as instructors and students as learners could see where we're at so that they could adjust accordingly.
Mm-hmm.
Any additional questions, Emily?
So we don't have, we had a few people who said, one person said they had to go early. Daniel said he had to go early, but thank you. He learned a lot and will apply it this week. Okay, we have somebody who said, Judy says, application in the clinic setting of anatomy, physiology, and pharmacology in making the differential diagnosis is very important. The answer to the test question is evidence-based and applies to the care of the patient.
Agreed.
We had another person who commented earlier just that, just the comment that the comparison of learners A, B, C, and D was great, and wish that we had seen this in medical school. The different types of learners, I think, who your kind of visual of the different types of learners who got 60% on the exam. So I saw several people who commented about what they would apply this week, who mentioned something about asking more specific questions of what type of guessing they had done. Was it correctly or incorrectly for narrow guessing?
Excellent. That's one of the biggest insights that I've developed in working with students, certainly.
Mm-hmm. Right now, we don't have any other questions coming in.
Okay. Well, as I mentioned before, please email us if you have questions. Any of the three of us are happy to answer your questions, to continue this dialogue in a different format. Before we go, let me just show you the, my screen has actually frozen, Emily, so I can't show you resources, but when you look online, there are resources and references that you can refer to see some of the work that we drew on today. So Emily, I'll hand it over to you.
Yeah, absolutely. And so we will, that actually ties right into the fact that I was going to thank all of our panelists so much for this wonderful presentation, and thank you to our audience, and that we're actually going to make a recording of this webinar available within 24 hours of this live event. That we'll post it online at the STFM website under STFM/MSE for the Conference on Medical Student Education part of our website, but that we will also make this we can make the resources and references for this available as well. So we can make a handout with those resources and references available. So anyone who's kind of curious about the resources for this will be able to access it through the recording and through the references for the slides. So we'll make that available on stfm.org/MSE. So thank you again, and also don't forget to take a look at the 2020 Conference on Medical Student Education, and thank you so much for all of our panelists today, and thank you for joining us.
Thank you, Emily.
Thank
you.
Bye-bye.
Thank you all.